I was that little kid whose father was a primary doctor, followed him around the hospital. So I am a specialist in vascular surgery, and I also trained in general surgery in the past. We take care of patients from, their early 20s, late teens, all the way up into nonagenarians, because honestly, vascular surgery can affect you at any part of your life and affects everything from your head and neck vessels all the way to your feet. When I meet a patient for the first time, I think a big part of that is getting to know them. Vascular surgery patients in general, just like cardiac patients or cardiology patients, have a lot of health problems. And so sometimes that biggest initial meeting is about calming their anxiety about their diagnosis. Once you kind of break that wall down, you can actually get into, why they're here to see you. What's their problem? Do they have other vascular conditions you treat? We'll see a lot of patients with aortic aneurysms who usually present without any symptoms, but it's incidentally found. So sometimes, a workup for abdominal pain can find an aneurysm. Other patients can present with stroke or blockages in their neck arteries, which is kind of something we specialize in. And then other patients will have wounds on their feet, pain in their feet, or even pain when they walk, which could be a sign that they have blockages in the arteries that run from their kind of pelvis all the way down to their feet, which can be causing kind of blood flow problems to their feet. Here we have an integrated vascular lab that can do ultrasounds on their legs, do blood pressure cuffs to see what the blood flow is like in their hands, on their feet, look for how significant the degree of blockages in their neck arteries. And we also use kind of CT scans, MRIs, other imaging to validate the diagnosis that we're working with and kind of characterize who needs an operation versus who can just be managed with medicines. So when I initially trained in general surgery, I looked for a field that was kind of encompassing everything. I wanted to diagnose a patient initially, and then I wanted to be able to treat them eventually. And I think vascular surgery is the field that kind of does that. We get newer technologies that are developed every day, every month, and it gives us the opportunity to provide these cutting edge techniques, seeing a patient, treating them, and then having them come back at the post-op visit, smiling, happy. I think that's the biggest win.